Good afternoon, everybody. Thank you so much to Governor Healey, Lieutenant Governor Driscoll, Secretary Mahania, Undersecretaries Rosenthal, legislators, leaders, and all of you wonderful supporters in the room, for this opportunity to share the perspective of a community health center and a healthcare leader. My name is Maria Celli. I'm a psychologist and the CEO of Brockton Neighborhood Health Center. We're a community health center serving nearly 40,000 patients from Brockton and surrounding communities. We offer over 200,000 annual visits across many medical services: primary care, OBGYN, behavioral health, addictions treatment, dental, infectious diseases, nutrition, eye services, and the list goes on. We offer this through a patient-centered model of care. But we are way more than a healthcare provider. We are a trusted pillar of the community we serve. At Brockton Neighborhood, like many other community health centers, we work hard to create and promote trust, which we've spoken about, as well as access and engagement with all the comprehensive primary care services we offer. We do this because it's not only the right and caring thing to do, but it's also the smart thing to do. The more we make healthcare in the Commonwealth welcoming, safe, and easily accessible for patients to engage with, the more they can take care of themselves, their families, and their communities. Let me be clear. Any interruptions, including interruptions due to fear of immigration enforcement actions to healthcare access and engagement, is a problem, not just for one patient, not just for their caring family, not just for the hardworking providers who care for them, but for everyone, all of us. When patients avoid primary care out of fear, it creates problems. Delays in care can turn manageable health concerns into serious, sometimes life-threatening conditions. We know patients who don't get their screenings because of fear early are diagnosed with cancer, maybe at stage 4, when they could have been caught at stage 1 and been treated. This leads to higher costs and unnecessary suffering and loss. When people can't access timely treatment for infectious diseases, those diseases spread. When people cannot access timely treatment for their chronic illnesses like hypertension and diabetes, these illnesses progress, recovery becomes harder, health disparities widen, costs rise, and everyone in communities suffer, from the patients to families to schools and even businesses. If people's access to primary preventative care is interrupted for any reason, they end up showing up also at emergency departments for needs that would have been better served in our offices at community health centers and clinics and local hospitals. And then the people who are there for needed emergency care at the emergency rooms have more difficulty accessing it, and the total cost of care becomes so much more expensive. At community health centers, we see every day how prompt, accessible care protects not just individual patients, but the overall health and stability of our communities. We see it in our patients. Many of the patients in our communities at health centers are immigrants. They're hard-working individuals. They are mothers working multiple jobs, children eager to learn, grandparents trying to take care of their grandchildren. They are families and workers who are fueling our local economies. At many community health centers like Brockton Neighborhood, we also proudly hire from the communities we serve, making many of our healthcare staff brilliant, dedicated immigrants who represent the best of this Commonwealth. The best of this nation, and the best of the world. I am a proud immigrant, and I feel privileged to be here and to work alongside anyone else, a lot of whom are behind me and around me, who believes in the dignity of all people, in making the world a better place in the areas where we can impact it. That is the way I was taught by my hardworking immigrant family, and that is what I try to bring to my everyday at Brockton Neighborhood Health Center and in any space I occupy. In addition to supporting patient health and well-being, we want to keep trying to support our healthcare staff, our doctors, our nurses, social workers, all of us. They bear a lot of burden already. I think we know that. I think everyone here probably knows a healthcare worker and knows how hard that work already is. They work so hard to care for our communities. I know, I see it every day. Let's not add extra fear and stress to them either. I think we can all agree that we want to keep moving towards reducing their stress, not exacerbating it. I think it's clear that safe, timely care in healthcare facilities isn't a convenience. It isn't just a right. It's a critical component of our community health across the Commonwealth. Healthy people can be active participants in their families, communities, and our local economies. Stressed providers can focus on care instead of fear. And all legislation that supports, protects, and promotes this critical healthcare access and engagement and the amazing workforce that provides it is a policy worth celebrating. On behalf of patients, providers, community health centers, other healthcare entities, and the whole Commonwealth, I would like to say thank you. And thank you for the opportunity to share this humble perspective.